what does this tell us about the efficacy and safety of PDS that we might not have known before?
So the end of study results, as the name implies, is at the conclusion of the study when all patients have completed all follow-up and all data has been reassessed. And primarily, it's a good way of looking at safety. The advantage of this study and the reassuring nature of the study is that there were no new safety signals, that the adverse event profile was still very low, and it was consistent with what we had seen in the interim analysis and in the primary outcome analysis.
Could you think of any reasons why a patient might opt to not receive PDS based on this sort of data and the fact that it's not approved yet? But based on this data, could you think of any reasons why a patient might choose to get the regular injections versus a PDS?
Sure. So one thing to keep in mind with the study design was that all patients who enrolled and who received the implant had already been treated with at least 2 intravitreal injections. And that was to demonstrate that they actually were responsive to anti-VEGF therapy. Patients have, just by human nature, I think, have a range of response personally and a range of preference. This is a surgical procedure, which is a trip to the operating room. And granted, it's an outpatient procedure. It is done under local anesthesia, but it's still surgery, and surgery is never trivial. Some patients, after the first 2 or 3 injections in the office, may feel that they're comfortable with that. They may feel that they'd like to try monthly or even bi-monthly treatments, and maybe it's not a hardship for them. And they have to balance that burden on themselves, on their caregivers, versus the risks, however small it may be, as well as maybe the psychological hurdle of going through a surgical procedure. I think we see it in our practice with patients who have other conditions that we know are treatable surgically, and yet a patient may hesitate and may prefer just to live with it or find an alternative treatment.
Okay, thank you for that. And now, obviously, a lot of people are waiting with anticipation to see results from the phase 3 Archway trials. Is there anything that the end of trial results does it leave you with any questions going forward that you would like to see answered in the phase 3 program?
So the latter results informed the protocol for the Archway trial. Specifically, there was a mandated refill at 24 weeks, so that in patients who receive the PDS implant, by protocol, they will be getting a refill at 6 months, whether they need it or not. Now, they are eligible for supplemental treatment if they meet criteria such as drop in vision or disease reactivation, but by protocol, they are getting something every 6 months. What would be interesting would be to see how many of them really need it at 6 months, would be to see what their anatomy and what their visual acuity are doing at 6 months, because the potential power for this treatment is to delay injections even more. I think the other interesting questions will be how patients will respond to it anatomically, as far as any new safety signals, but also as far as how the implant is tolerated. Some of them may be holding it even longer than the latter trial.
All right, that was about it on my questions, really. Was there anything else about your analysis or any other insights that you would like clinicians reading this article to have?
Well, I think this really is the most exciting new treatment option in over a decade. Anti-VEGF therapy was the first major breakthrough. It allowed us to give some vision back, or at least to stabilize vision in the majority of patients. But then that treatment burden becomes fatiguing. So then the next innovation really is a long-acting delivery system that gives us the results with fewer treatments. And all the early indicators are that the PDS implant may be that platform. It's also being applied to diabetic macular edema and diabetic retinopathy. So that's another horrible disease state that affects millions of our patients that may be amenable to such a platform.